Hello, everybody. Thank you for your time. It's an honor to present and share knowledge on personal protective equipment. I've worked with Adriana for several years, and I think we're glad that the issue of PPE and the technical aspects of PPE are coming to light, and they are important issues. So just to get right into it, this will be a very brief overview of the technical aspects of some critical PPE items. Can everyone confirm that they can see my screen?
Yes, we can.
Okay, thank you, Alessandro. Yes.
We can't see you. We wish we could.
Oh, sorry. Okay, I'll do that for human factors' sake. Yes. Hi, everyone. Thank you for your time. So I'll just go right into those details that everyone might have some questions on, and hopefully I'll shed some light on the ambiguity that sometimes is related to PPE. So the general outline of this presentation, as stated, we're just going to look at three critical items, the standards that are in place to ensure the technical performance of those items, and reference documents to help you dive deeper should you have the time or the need when you procure or use PPE. So the first item is a medical face mask. That's a technical term for what we see a lot. This is the most common piece of kind of respiratory protection. It's very simple. It's made out of non-woven materials. There's two layers of what they call spun bond, which is kind of protecting the middle melt-blown layer, and the melt-blown layer is what gives you the filtration that you see rated as 95% or 98%. There are very well-established American standards, European standards, and now because of supply, you might encounter the standard from China. So it's the YY. There's also a T sometimes, so for simplicity, the numbers are what are more informative. So 469 is a surgical mask. So this means that it's fluid resistant. It's tested for fluid resistance. And 969 is non-fluid resistant. So there is the same parallel standard within the American and European standards. And typically these are tested for bacterial droplet filtration. So these are 3-micron particles. The American standard tests for sub-micron filtration at 0.1 micron latex particles. What's important is that even though you go up and up in filtration, you also may experience higher breathing resistance. So the pressure drop is what they call it. So the pressure inside versus outside, the difference of that, the wider that difference is, the more difficult it is to breathe, and the less air permeability there is. So that's actually very critical, just because if you get too much of a barrier from the front of the mask, then because of the structure of it, the leaks around the nose and the mouth and the cheeks, that's where your unfiltered air will go out or go in. And the primary design of these masks is for source control. So for in surgery, you'd have the surgeon look over the open cavity, depending on the surgery, and it would catch the droplets that go into the patient. So that's really the design and intent of this kind of mask. So fluid resistance can be tested at 80, 120, and 160 millimeters of pressure. Europe only uses the middle one, and so does China. But the AS Team US standard rates 1, 2, and 3 based on this pressure challenge. Other tests include flammability and microbial cleanliness. But really, when you're looking at purchasing or assessing or looking at test reports, you should really just look at filtration and breathability, and if you'd like fluid resistance.
Ying, can you take your volume up a little bit? Some folks say they're having trouble hearing. Thank you.
Oh, interesting. Maybe it's just because the mic is on my computer. Okay, I'll try my best. Actually, I'll kind of be going closer to the camera. So in terms of the American standard, this is really coming out of the ASTM standard. This is the table that you'll see. And this is what will tell you all the different parameters which categorize it into pass-fail for each level. And the European standard is similar. You'll notice that actually type 1 is, according to the standard, for patients during pandemic, epidemic situations. So we at WHO accept type 2 and type 2R for healthcare workers. In terms of the respirator, this is interesting and different from the previous medical face mask in that the main feature is that it tests for a different particle challenge, which is sodium chloride, and this is like about 0.3 microns versus bacterial droplets, which are 3 microns. Very standardized. NIOSH does their testing. Europe, Great Britain, Japan. There are many standards that are defined by occupational health organizations from those regions or countries. They may be valve, non-valve. They're made up of more layers than medical face masks, which are 3. So it could go up to 7, 9, and sometimes they're more rigid structures like the green one that you see below, or the panel that you see below as well. And breathability is allowed to be higher because it's a thicker material. But this is where a good manufacturer will give you that balance, breathability and filtration. Another very important part of a respirator is its fit. So fit, in the EU, EU masks will be tested with 10 human participants. They have various facial dimensions, and they go through exercises in a box, and then the challenge is floating around them in the box, and then there's a sensor inside that looks at whether any of the external particles are filtering in. So respirators, due to the fit and the seal around the face, they're 95% filtration, or FFP2 94 or 96, 401, or N99 or FFP3 at 99% filtration is a guaranteed filtration for that challenge, because it assumes that it also passes the fit test. So any of the air that's being breathed in is going through the material surface and not the sides, which are controlled for respirators. That's why if you have to be a bit more careful with respirators and ensure that at least the fit is there. And that's really what guarantees a 95% filtration. So for medical face masks, because it's a loose fit, it's not really filtering everything. There's no guaranteed face seal. It's not tested for that. So even though you have 95% bacterial filtration of droplets, you may still have droplets coming in and out, or coming in and out. So that's the main difference for a respirator.
Unfortunately, 1 more minute. Thank you.
Yeah, I'm almost there. So in terms of the CO2 clearance, it's very important that people don't get CO2 toxicity, so that that the CO2 is cleared quickly. In terms of face shields, there's disposable and reusable. The reusable standard is the ANSI Z78.7 or the EN166. They're very stringent standards, but they apply to reusable face shields. And generally, you should look for clear plastic. You should look for a foam so that the plastic's not close to the face. And anti-fogging is less of an issue because it's an open structure compared to closed goggles, which those standards apply to as well. And so to reference any technical information in further detail, the disease commodity package is coming up in version 5. There's more details about the tech specs and more description as well. And a lot of these standards are now freely available. So this is a change from before, and more knowledge is better. So that's it for me. Thank you.
Thank you very much for your very clear and comprehensive presentation. I would go directly to Adriana, and while she's shared the screen, I just invite all the attendees to write your question into the question box, which you should have below your control comment. We will answer all the questions later, and if we don't have enough time, we will continue offline. So please let us have your question. That's the main goal of those seminars.